Well, we always start at the state capitol for session with the governor's state of the state. So the governor comes to a joint session. All the House members, all the Senate members come together. Even the courts come over and listen. And the governor gives priorities for the year, a state of the state. And we listen carefully. We want to know what the governor's emphasizing. And the big thing we found was what he wasn't talking about. He really focused on big business. I didn't hear anything about small businesses or anything about workers' well-being. I'm concerned also that the only educational things he talked about was money for private schools. And so I didn't hear anything about how we're going to improve our public schools and how we're going to make sure the Department of Education is doing their job. We also were concerned, he said nothing about health care. I'm deeply concerned that we're not thinking about how are people paying for doctors? How are they accessing doctors across our state? We've heard again and again that that's a big concern for people. So one of our big concerns was what we didn't hear from him.
The other thing that typically happens early in the session besides the state of the state is the executive budget. What do we know about that so far?
Yeah, the governor's budget, he made a proposal, but he just made blanket cuts across all the agencies. And we can talk more about that, but I think the big reason I'm concerned about that is it doesn't consider what the public needs. So he didn't look at, public safety's needs and where those challenges might be for our communities. He didn't seem to be looking at, child welfare. We finally made improvements in our foster care system. Is this going to cut into that? And so what I'm worried when you take a broad brush to cuts that maybe you're not considering how that affects the people of Oklahoma. He also really emphasized a tax cut again. And what I want to emphasize is that tax cut should not go to big business and to our wealthiest Oklahomans. If we are going to do tax cuts, they need to be targeted to those people who are struggling to get by. And there's very strategic ways we can do that. But what I hear him doing is these blanket decisions that are not good planning.
And just real briefly, you yourself have a couple of bills. I know there are members of the Democratic caucus that do also, but can you touch on those very briefly?
Yeah, one of the bills that I think would be the easiest and most straightforward is called the Sales Tax Relief Credit. And it's a small credit that applies with an income level to make sure that people get a little bit of money back from the sales tax they've paid. Right now it's been $40 since the early 80s. I have a thing that would move it to a bill that would move it to $110 per person. And that would do more for people who are middle income and low income than any of the cuts that the governor's proposing.
Well, speaking of the budget, in the last couple of years they've had committee hearings from the very beginning of the session and they hit the ground running, but they decided to do things a little differently this year. Can you explain that process?
Yeah, I'm really happy that the Senate leadership has decided to continue budget transparency. And so this is letting the public see the decisions that are being made about our budget. So we started this week, Senator Chuck Hall, who's the appropriations chair, having budget hearings. And these are bipartisan meetings where we get to ask questions of the agency about what they're requesting and what their priorities are. We heard a lot of agencies that are having challenging hiring, keeping people in office, in their staff, and providing that service, that adequate service to the people of Oklahoma. I'm talking about everything from our health entities to our investigations and making sure we're doing medical investigations when there's problems. All week we did that, so we're really getting a good sense at the beginning of session what to expect in terms of the conversations about the budget this year. And today we get a briefing about the estimates. So basically, we have economists who give us those numbers of what they think might happen next year. They're making guesses about the economy. And so we're going to hear that today and get to ask questions about where those dollars might come from and what comes from taxpayers and how those could be applied.
What is your main concern about moving forward with the budget? What are your priorities with the Democratic caucus in the Senate?
You know, we want to see thoughtfulness when it comes to what people need in communities and those things that cause prevention versus crisis. So if we cut money to something like prevention, like State Department of Health, we're going to end up with bigger costs on the crisis end. Same with everything from criminal justice reform to mental health care. And so we very much want to see those funds thoughtfully applied, and we can't do blanket cuts.
So next week, week 2 of the legislative session, and hitting the ground running on committee work, is there anything people need to be aware of?
Well, you know, legislators can file any bill they want, and just so you know, the senators can file as many bills as they want. So people are going to see a lot of bills that probably won't get hearings or won't make it through the process. Next week is the beginning of that process. Each Senate committee has to vet bills before they can move forward, and so we'll be doing that I think there were 1,200 bills filed in the Senate, so there's lots of different issues. I hope we hear from people about their concerns. We already have had major bills get pulled back because of public concern, and I think that's exciting to see.
And of course, people can tune in and listen and watch if they want to, right?
Absolutely. oksenate.gov has all our live proceedings. You can also see past proceedings. If you want to watch something, you can see it in our archive on the calendar. So please follow along. Be in touch if you have concerns.